In German, cataracts are called gray stars. The lens of the eye, which is designed to focus light, becomes cloudy with age and turns gray. In some patients, these changes begin as early as 50 years of age, very gradually, and absolutely painlessly. Clouding of the lens makes the light falling on the retina more diffuse, a person sees blurry. Distinguishes colors worse and worse, spatial vision changes, circles appear around light sources. Cataracts are associated with the natural aging of a person. But an important role can also be played by ultraviolet rays, excess sunlight, as well as infrared radiation, excess heat, too little physical activity, smoking, diabetes, nutritional deficiencies. Eye injuries, side effects of taking certain medications. Cataracts can also be found in children. Rubella suffered by the mother during pregnancy can cause cataracts in the fetus. Also, such diseases in pregnant women as viral mumps, hepatitis or toxoplasmosis are risk factors for cataracts in the fetus. When the lens is clouded, neither glasses nor laser vision correction surgery help. There is only one way: surgery. It consists of removing the clouded lens from its capsule through a tiny incision in the cornea, and then inserting a lens into the capsule, an artificial lens. The operation lasts about 10 to 20 minutes, healing of the tiny incision on the cornea, several weeks. The patient, as a rule, feels the moment for surgery himself, when his quality of life is already suffering too much. Ophthalmologists advise not to postpone cataract surgery for a long time, since clouding of the lens not only limits vision, but also poses a danger to the patient and others when driving a car or in many everyday situations. Falls and accidents happen faster if a person cannot clearly navigate the surrounding environment. Selecting an artificial lens is a serious decision. There are many lens manufacturers. Each model has its own characteristics and its purpose. It is interesting that when planning a lens replacement, with the right choice, it is also possible to correct other vision errors. For example, myopia, hyperopia, correct the effect of corneal curvature, etc. Depending on whether the patient is already known in this hospital, what complaints and previous diseases he has, additional examinations may be carried out. First, an interview about the medical history, complaints and concomitant diseases. Using a special device, the refractive power of the transparent media of the eye is measured. Then, checking the visual acuity of each eye in turn, at a distance and near, first without corrective lenses, and then with them. If necessary, additional studies of visual functions are carried out. If necessary, eye mobility and pupil response to light can also be examined. Intraocular pressure, important for detecting glaucoma, is measured using a flow of air, non-contact. The ophthalmologist then examines the eye using a slit lamp. Through the slit lamp, the doctor examines the anterior segment of the eye, including the eyelids, conjunctiva, cornea, anterior chamber, iris and lens. He can also measure intraocular pressure by contact if necessary. Eye drops are then administered to dilate the pupil. This makes it much easier to examine the back of the eye and assess the condition of the lens. It takes about 20 minutes for the pupil to dilate sufficiently. The fundus of the eye is examined using a magnifying glass and a lamp shining through it, or using an ophthalmoscope. The back of the eye is also examined in the slit lamp using an additional magnifying glass. After these examinations and, possibly, other diagnostic methods, an interview is held about the results and appropriate treatment is prescribed.